Could your cosmetics be ruining your hormone health, possibly your personal care products like toothpaste and mouthwash? Well, there's only one way to know, and that's to join me today for the Wild Wisdom Show. I'm Dr. Patricia Mills, a holistic medical doctor with a root cause approach to health. And today we're going to be covering how most cosmetics and personal care products harm your hormone health and which ones to use instead. So first, let's dive into what is the concern around cosmetics and personal health products. Because just so you know, this is kind of a recent issue in the grand scheme of things, and it's picking up steam because a lot of men and women are experiencing problems with their hormone health, and this is a very important and potentially significant root cause. I know it was probably one for me. So, the average woman in the US uses 12 cosmetic products composed of 168 chemical ingredients daily. So, we're getting about 168 different chemicals on our skin every day. And men are not immune to this. When a recent survey by the Environmental Working Group saw that men's personal care product use has almost doubled to 11 per day from 6 daily in 2004. And research is indicating now that not all of these chemicals could be safe for human use. Some of them could actually be quite harmful, which is what we're going to cover today, because I'm going to teach you which ones to be worried about and how to choose cosmetic and personal care products that will not ruin your hormone health. So, in order to really dive deeply into this topic, we have three questions that we have to really be able to confidently answer. Question number one is, do chemicals that we put on our skin get into our body? And question number two is, if they do, what kind of harm, if any, do they cause? Do we just pee them out or poop them out? Are they benign, or do they actually ruin or harm our hormone health? And question three is, if so, how can I choose safe cosmetics and personal care products for better hormone health? And we're going to be covering all of those questions today. So let's start with question number one. Do chemicals from cosmetics and personal care products get into our body through the skin? And there are certain chemicals that are starting to be more and more, in the concern by researchers. You can hear about it sometimes on medical news talking about it. And they are in cosmetics like phthalates, parabens, bisphenols. They're in sunscreen like the benzones, which are the chemicals, sun filters. They're in toothpaste, mouthwash, liquid soap, shower gel, body lotion, facial moisturizers, and deodorants in the form of triclosan, which is a antibacterial agent, but actually has been shown to cause quite significant harm in humans. So we're going to cover what that is, and you should really pay attention because this is stuff that you do not want to have happen to yourself. So one of the more fascinating studies that I found was that the FDA, the Food and Drug Administration in the US, did a study in 2019 looking at sunscreens. And they took humans and put different kinds of sunscreens on their skin. And then they measured their blood to see if the chemicals in the sunscreen, the ones that are potentially concerning, like the benzones, like oxybenzone, avobenzone, and others, whether or not they were being found in the blood. And the researchers were surprised because within 3 minutes of putting the sunscreens on the skin, these chemicals and other potentially harmful chemicals were found in the blood. But not only were they detected in the blood, but they were there up to 3 times more the safety level that the FDA recommends. So obviously very concerning. And the researchers themselves said, oh my goodness, so the systemic absorption of sunscreen, systemic is the medical term for into the body, like it's not just staying in the skin, it's actually being taken up into the body, into the bloodstream, which means that it can go to and affect other organs like the brain or the testes, the ovaries, the thyroid. And so what they're saying is that these results support the need for further studies. And this is important because this was only done in 2019. And a lot of the regulations in our cosmetics and personal care products have not really been updated for at least a few decades. So we really need to pay attention to these new studies. And then these researchers went on in 2020 to repeat the study in more participants using more sunscreens, and they found the same thing. What you put on your skin gets into your body. And these are potentially harmful chemicals. Now that's sunscreen. What about makeup like foundation, blush, mascara, lipstick? Well, another study in 2018, also fairly recent because it's 2024 now at the making of this show, they found that when they took women who reported using makeup and these things more than women who said they used less, the women who used more had significantly higher concentrations of phthalates and parabens, which are, we're going to talk about them. They're actually called endocrine disrupting chemicals in research. Endocrine is hormone, is a fancy medical term for hormone disrupting chemicals. So they are known to disrupt your hormone health. And so they found that these women had more of these chemicals coming out in their pee, which means that they put it on the skin, went into the body, and then the body's peeing it out. And unfortunately, this also seems to be the case with babies. So the American Academy of Pediatrics did a study looking at infant care products, specifically baby shampoos, baby lotions, and baby powders. And these babies had more phthalates in their pee. Okay, so should we be worried? It's getting into our body and our body's peeing it out. Between the time it gets in and the time it gets out, is it causing harm, right? That's question number 2 to our hormone health. And so here we go. That triclosan that's in toothpaste, mouthwash, liquid soap, shower gel, body lotion, facial moisturizers, and deodorants, research has shown that in women, it can cause low thyroid functioning. So it can actually harm your thyroid health. It increases the risk of infertility and increases the risk of spontaneous abortions. Now, I don't know about you, but I know a lot of women who are suffering from low thyroid function, hypothyroidism. They see on their blood work sometimes there's abnormalities. Maybe they feel like that low energy, fatigue, that weight gain. I know a lot of women suffering from infertility, and unfortunately, I have heard of a lot of spontaneous abortions, including with loved ones. So this is, close to my heart, and I'm sure it is for many of you as well. Now, this study that talked about this, I'm putting this here because it's kind of controversial when people talk about these things. So I'm just going to give you the study for those of you who want to look it up. And if you're listening to this in the podcast, you'll want to head over to my YouTube channel. And I'm putting here the study reference, including the PubMed ID that you can use to find the study online. Now, what about bisphenols? Those are chemicals that you find in things like lipstick, face and eye makeup, and nail polish. Well, here's the bad news. Bisphenols look a lot like estrogen, and they go into the body and they activate estrogen receptors. So they act like estrogen in the body. Now, estrogen is one of those hormones where you don't want too much and you don't want too little, right? Too much can cause things like cancers, and too little can cause things like problems with your menstrual cycle, fertility, and menopause. So you don't want anything getting into your body that can confuse it and mimic estrogen's function. So that's not good news. It has been also just shown because you're getting too much of one other estrogen-like chemical, it starts to impact the health of other chemicals like progesterone and testosterone. And it's been shown to be a potential risk factor in polycystic ovarian syndrome or PCOS. So again, not good. And phthalates. Remember the phthalates in the babies and in the women? Well, phthalates are found in perfumes, nail polishes, hairsprays, aftershave lotions, cleansers, and shampoos. And they've been linked to hormonal changes in pregnancy, potentially affecting ovarian function of the ovaries. They've been linked to endometriosis and the formation of myomas, which is a kind of like a smooth cancer of the uterus. So also not very good. And again, men are not immune. Here's a study published in 2014 looking at the effect of these endocrine disrupting chemicals on male reproductive health. And men, the way that it shows up for them, and if you're a man, for you, is decrease in semen quality, increased risk of infertility, and changes in your testosterone levels, and not in a good way. And there was more. So again, you can look up the study if you want to. And what you may be thinking by now is, why on earth are these chemicals present in cosmetics? What about government regulations? Like, why do we not have regulations, not permitting the use of these chemicals? Well, first, why are these chemicals put into cosmetics in the first place? Well, nail polishes, these chemicals are used to reduce cracking by making the polish less brittle. In perfumes, they're used as a stabilizer to keep the scent longer on your skin. In hairsprays, for example, it helps avoid stiffness by allowing the hairspray to form a flexible film on the hair. And for the face and the body, it allows a smoother application and a uniform distribution of the liquid. So we are getting some benefits from these chemicals, but are they really worth the risk and the potential harms? And the thing is that not only does risk tolerance vary from human to human, like I might not be okay with certain things like the potential risk. And maybe you're like, oh, you know what? I'm okay with that. I'll continue to use my cosmetics and personal care products that have these chemicals. So we have a person to person risk tolerance difference, but there's also a difference in risk tolerance that varies by country. So here's an interesting one on phthalates, for example. So there are no regulations restricting the use of phthalates in the United States or in Brazil, but the European community has banned phthalates. Like they don't even allow it to be used, period. So what a huge difference. And then in Canada, where I live, they've restricted the use of 6 different phthalates in children toys and articles, but does not ban their use in food packaging, cleaning products, cosmetics, paints, and other products. Now, I'm trying not to get too judgmental about this, but it kind of, makes my blood boil just a little bit. So interestingly, also, you might say, well, why don't I look at the ingredient list and I can look for words like phthalates and parabens and things like that. The thing is that that's helpful and you should definitely do that. However, for example, in the US, the FDA does not require that a industry or company list the ingredients found in flavors or fragrances because they're considered to be, trade secrets, like what makes one product different from the other. So therefore, if you look at an ingredient list and it says the word fragrance, like parfum, or flavor, it could have phthalates in it, for example. That would be allowed to be listed underneath that ingredient category. So then the third question is how to choose a good product. And I'm actually going to give you 2 options on how to choose a good product, as well as 2 tips. And if you're joining me live, I see that there's a number of people joining me live. Hello, and feel free to put your questions in the comments starting now because there is a delay between when you type them in and when I receive them, and I don't want to miss your questions. All right. So let's start with option number 1. So option number 1 is you can go to the website ewg.org. So that's the Environmental Working Group website. And they have a database called the Skin Deep Database. And you'll see a tab there that you can click on. And they've done a lot of the work really honing in on these potentially endocrine disrupting chemicals, or in other words, hormone health harming chemicals. They also look at other things, chemicals that can cause cancers, for example. So it's a very full bodied look at those potential toxins. And then they go through and they rate the safety of these different products. So you can go in there and you can either look at what they verified, EWG verified, or you can type in and see, like, let's say you have a favorite product that you love. You can see if they have done an analysis on that product. They also have, a database for home cleaning products and that kind of thing. So it's always interesting to check that out. Now, let's say though you go to ewg.org and they don't have the product that you're looking for. Let's say you're checking out a new product and it hasn't been analyzed yet. You can actually go to another website, which I really have a fun time geeking out on, called cosdna.com, cosdna.com. And you're going to get into a website where there's a bunch of tabs across the top, and you want to click the tab that says Analyze Cosmetics. And then there'll be a space to put in a bunch of ingredients. And what you do is you check out on the website of the product that you're interested in. So let's say it's like a lipstick. and you go to the website where that sells that lipstick, and you find the ingredient list for that lipstick. Now, it might take you a bit of work to do, actually, because these companies sometimes don't make it easy to find the ingredient list, but they are required to list it. So it might be like a hidden little tab or a little kind of plus button that you look at and you click on it, and all of a sudden the ingredients pop up. Then you copy and paste those ingredients into the analyzed cosmetics form, the area there, and you click enter, and they will analyze the toxicity rating of each ingredient that they have in their database. So I love doing that because I have found out that some of the things I was using was not good for my hormone health. And other things were surprisingly good, even though they're more affordable, actually. And you know what? Price does not dictate the hormone health factor. There are some products out there by seemingly pretty good companies that are quite pricey compared to other companies, and their products are not ones that I would use anymore. So do the homework. It takes a little bit of effort up front, but then you reap the rewards of having good hormone health moving forward. So, tip number one is that for a sunscreen, the ideal sunscreen will have a non nano zinc as its sunblock, which is zinc is a mineral. And if it's non nano, it means it's a size that will not allow it to penetrate the skin. It won't be absorbed. It'll simply sit on the skin and reflect the sunlight. So it's a sunblock. What you don't want are the chemical filters like the benzones, oxybenzones. Those ones are the ones usually found in more expensive products. So my favorite sunscreen is by a company called ThinkBaby. And there's other ones like, Green Beaver and those Badger, I think it is. So I'll put a few links in the show notes to my favorite sunscreens. And so those ones are really clean, and you definitely want to get that right because you're lathering it on your skin. And again, it gets absorbed within 3 minutes, right? So you don't want to get that one wrong. And tip number two is that, get creative and start doing some things yourself. Like, for example, body lotion. Again, body lotion is something you definitely want to get right, because if you're slathering on a body lotion with an endocrine disrupting chemical, that's not good, right? So here's a do-it-yourself tip. Again, you can find products using those two websites. You don't have to make one yourself, but if you do, I like to buy a glass bottle, a pump bottle, very affordable, just a couple of dollars at like a dollar store or IKEA. And then I fill it with oils, and it could be a sesame seed oil or an avocado oil or a olive oil. I don't like to use coconut oil because it's hard to spread and it gets a little bit stick and thick. So I like to use the liquid oils. The key is you want to use an oil that is not extracted using chemicals. So it's hexane free. It's going to say it's either cold pressed or expeller pressed. And it should be organic because toxins tend to accumulate in oils. And the oil will be absorbed into your skin. So you definitely want to not get any toxins being absorbed into your skin through your oil. And I like to rub on the oil before hopping on the shower. And then I just have a nice shower, and afterwards I'm left with a sheen of oil on the skin. It's not so much that it would get onto my clothes and ruin it, but it's quite hydrating. And if I have the chance, I'll put the oils in and kind of hang out with the oils on the body and kind of do my, brush my teeth and all that kind of stuff. Let it sink in a little bit before I hop into the shower for a little bit more moisturizing action. Some people like to add in a little bit of castor oil, which is thicker and has ricinoleic acid, which can be quite good for especially dry spots on the skin like the elbows or the knees. And there's also what's called jojoba oil, which is spelled jojoba oil, Jojoba. And that actually isn't so much of an oil, but more of like a wax from a type of plant that's found in the desert that really protects the outside of the layer of the plant. And so that oil will kind of sit on the skin and give you a little bit of skin barrier protection. So I hope that helps for you in your healthy hormone cosmetics and personal care products quest. So the take-home message is what you put on your skin can get in you and may harm your hormone health. Not all the time, not with everything, but it's definitely worth paying attention to, particularly with even toothpastes and mouthwashes. Start paying attention to your cosmetics and baby products. It really will pay off in better hormone health. So thank you everyone for joining me today. I hope that you enjoyed this. If you did, please subscribe, save, and share. Sharing is caring, and you never know how someone else may incredibly benefit from this wild wisdom. And I look forward to seeing you next week. Have a wonderful rest of your day, evening, or night, depending on when you catch this.